Okay. Hello, Jennifer. Thanks for coming in today. So we've just completed a full assessment and we did a breast exam and a pelvic exam. So with your breast exam, we found no malignancies, no discharge, no redness or anything that we were concerned about. There were no palpable differences between your breasts. We also did a pelvic exam and that showed no edema or erythema. And we also did a pap smear and that was all within normal limits. So today we're going to review your family history, your ethnic background, your values and beliefs. We're going to talk a little bit about genes today. Basically, you and I are both made up of different genes. And this is what makes us different. There's a lot of variations in our genes. So that's what gives us our eye color, our hair color, but it also gives us different diseases. We get our genes from our parents, and we get certain genes from mom and certain genes from dad. So we're going to explore that a little bit today with your pedigree chart. So here is your pedigree chart here. It shows 3 generations of your family and the different illnesses they have. So the squares represent the males and the circles represent females. And then when they are shaded in, that means that they've been diagnosed with an illness. And as you can see, we've reviewed your family history, and your grandmother was diagnosed with this disease, and she's the proband. That's why there's an arrow. She's the first one to exhibit this disease, and then your mother was also diagnosed with this disease. So basically, we're looking at breast cancer specifically, and we're also looking at the BRCA2 gene, which we're going to talk about a little bit more in depth today. And as we discussed, your grandmother was diagnosed at 39 and your mother was diagnosed at 47. And you are Caucasian, so that doesn't put you at a higher risk as certain ethnicities do for this specific gene. And then today we'll just discuss more about your risk and more of your concerns. So tell me more of your concerns that you have.
Okay, I have a few questions. So what is this genetic condition called? And I guess tell me more about it.
So basically, you and I both have a BRCA1 and a BRCA2 gene. We test for a different variant on that gene, meaning there's a little bit of a mishap or a variation in that gene that can cause disease. So family members in your family, they possibly could have this variation in this gene that caused breast or ovarian cancer. Therefore, they had an increased risk for these diseases. And this gene is a particularly high risk for cancer, whereas other genes, if they are mutated a little bit, they don't have to cause a disease-causing condition. So basically, this gene specifically is called a high-risk penetrance, meaning that's why we're going to look at this one specifically. And this means that one of your parents had the gene and that it may or may not show up in every condition, in every generation. There's always a chance that you can pass this gene on to one of your children. People who have this gene will often see, generations of breast or ovarian cancer, as you have seen in yours. And it is important to note that although there is a genetic portion to this cancer, other people can have this cancer and not have the genes as well. And yeah.
Okay, so how do we test for the condition?
This test is offered. There is a test that's offered for this condition, and there's also multiple gene panels where they look at other genes that could increase your risk factor as well for having breast or ovarian cancer. And they'll all be tested at the same time so that we can have a better picture of what your risk is.
And so why do we have to test for the condition?
So basically the reason for the test is that there are mutations on these genes or variants that are a strong risk factor for these types of cancers. The reason is because of your personal risk, because of your grandmother and your mother, so that's an increased risk, but also treatment is best followed when we can actually analyze which gene is the problem, so that the treatment can target that specific gene. So your survival would be, a lot better based on this. And then it would just narrow down our treatment options basically. And also the American Society of Breast Surgeons, as well as the National Comprehensive Cancer Network, recommend this type of genetic testing for people who do have a family history of breast or ovarian cancer. And also BRCA2 is actually more responsive to hormonal treatment than BRCA1, so that's another reason why we would test.
Okay, so this is a lot. I'm a little confused. So explain to me more simple and slowly. And then maybe, so why do I need this testing, and is it a blood test?
Yes, so basically it can be a saliva, blood test, or swabbing on the inside of your mouth. You may have heard of 23andMe. We call these direct-to-consumer genetic testing. So basically, they send you a little swab, and you swab your mouth and send it back, and they send you results. So these results are great for your personal use, but we like to do official testing from genetically approved testing. So basically, I will order the test, and it will be through saliva, blood, or swabbing of the mouth. And this is because the 23andMe, basically they don't analyze the different tests that they do. And based on your results from this test, we may be able to narrow our plan of care for you. So we may have to do more ultrasounds or an MRI to be a little bit more thorough in your screenings due to your risk. And then women with this gene actually have a 45 to 65% more likely of a chance of getting breast or ovarian cancer. So if we detect it early, there's a 99% chance survival. So that's a really good reason to get the test.
Okay, so how long does it take to get the results?
So it's pretty quick. At maximum, it would be within a few weeks. And you can also have some pre-genetic testing counseling, so that you can also know more of your options and conditions if you have further questions for a genetic counselor.
Okay, so what is the chances of my kids or other kids getting this?
So basically, if you have it, it's highly likely that you will pass it down. It can be hereditary for sure. And studies show that around 15% of women with breast or ovarian cancer have this BRCA2 variant in this gene. It is likely that 50% of your children are likely to inherit this gene. And then starting at the age of 18, we could test your daughters to really make sure they have routine screenings, because usually you don't do mammograms on younger kids, but we could do like ultrasounds or something like that to make sure that we are really staying on top of things for them, to make sure nothing slips through the cracks.
And so did I get this from my parents?
So basically there's like a 50-50 chance, as we talked about, of inheriting this, but yes, it's basically from a first degree relative. So as we can see from your pedigree chart, likely your mother. And this also though could affect other family members as well. So like cousins, aunts, and different people like that in your family could also be affected as well.
Okay, so how much is the test gonna cost?
Basically, genetic testing is, it varies widely. There's a wide range of how much it can cost. But because we are looking at a multi-panel genetic test for you, it would be anywhere from $100 to $4,000. And yeah, it can just vary.
And what about my insurance? Will my insurance pay for it?
So insurance companies usually cover 90% of the total costs for this specific genetic testing. If we needed to, we can do risk tool assessments, basically telling the insurance companies that we really feel like this is important based on your family history and also, based on different things. So we can send that to them as well as a written letter. It's called a pre-authorization letter. We can send that to your insurance company if needed, so that way hopefully we can get more reimbursement for you. But reimbursement is more common now than it was in the past.
So what if I cannot afford the test that you are recommending?
Yeah, this is a great question. So basically, if this is not something that you would like to do or that you can do, we'll still do your yearly mammogram screenings. You've been really good on doing those every year, so we'll keep doing that. We'll also suggest that you do pap smears yearly instead of like every few years. And then I would advise you to do self-breast exams. So basically, it's just being familiar with your breast tissue. So if you notice any changes like that, then I would have you come in and we can, look at those together. But just being familiar with your breast, once a month in the shower, just kind of making sure that you're palpating and not feeling anything different. Then I would encourage you to live a healthy lifestyle. So, eating fruits and vegetables, whole grains, getting plenty of exercise, and then refraining from smoking. We did go over that, and you're not a smoker. And then also getting your annual physical exams, getting your blood work and all of that drawn.
So what if my employer finds out? Will I lose my job?
So there are actually laws prohibiting employers from firing anyone based on their genetic records. So this was actually from the Non-Discrimination Act of 2008 through the Department of Health and Human Services. So no, they cannot.
So what about my health insurance premium? Is it going to go up if I test positive?
Your health insurance should not go up. The Health Insurance Portability and Accountability Act also prohibits this. It does not, however, extend to life insurance policies, unfortunately.
Okay. So will I have to tell my family if I have it, or will I have to tell them if I don't have it?
This is a good question. So basically, not necessarily. There are no legal guidelines surrounding family disclosure. So that's up to you whether you do that or not. As I explained earlier, you should know that knowing this information might be very helpful for family members for their future and for, getting tested themselves, or just making sure that they're up to date on their screenings or being more aware. Women are at a higher risk, but men are also at a risk if they have this specific gene. They are also more likely to have prostate cancer, melanoma, other cancers. So it is something that they could decide for themselves if you do tell them. Another thing to know is that, like I said, it can affect men too. So yeah, disclosing would probably be something that you should consider, but it's up to you.
Okay, so how do we go about this process?
So basically, I will order the collection of the specimens. So basically, I'll send you to a genetic laboratory who does this test. We don't do it in-house, but there is one that we can refer you to, and they will do a blood sample, and the results will then be sent to me. So when I get these results, I'll call you in and we can have another discussion about this, and I'll explain those results to you, and then we can go over different items on the results. One of the things that they will do if we choose to do the multi-panel is that there could be a finding that we were not expecting. So this is also something that we can discuss later on if anything like that comes up, but we can discuss it back in the office. And basically the benefits of this would be the ability to identify a plan of action for us moving forward for your best health and interest. And risks are very minimal because it's minimally invasive, but there is a risk that we find something that we weren't expecting which would just narrow our plan of care even more.
Okay, so how will I know the results?
After the results are reviewed, basically if you were to test positive, I would contact a breast specialist and an oncologist and also a geneticist. So basically different treatment options will be presented by each one of them, and the geneticist will be able to offer genetic counseling. And basically if your results are negative, this doesn't mean that you won't ever have the disease, right? It's just that you don't have the specific gene to cause this. And then there's also a possibility that the results basically come back of variants of unsure significance. So basically you have this gene and it doesn't look like what we think it should to be a variant for the BRCA2. So basically we could retest you, or we could just look at it at another future time. So basically those are the three things that could happen. Or uninformative, which is highly unlikely, but it still could happen. And it can be a variation of those three things. So basically we could do repeat testing, or we could just save it for future use. But I have explained kind of the situation and genetic testing to my nurse, and she can be a witness for us for the informed consent. Do you have any other questions before we proceed to sign this?
I don't think so.
Okay, awesome. Well, we will move forward and we'll keep in touch.